Welcome. This is Brian. I'm glad you decided to watch our video. Before we get started, grab a coffee, a pencil, and a paper as the video lasts about 7 or 8 minutes. You can stop the video at any time to take notes. We produced this video to help answer your questions about changes required under the Affordable Care Act. As some small businesses already renewed their 2013 plan, delaying the effects of the ACA until 2014. Yet others will continue to renew on their regular date in 2014. By the way, we refer to the Affordable Care Act as the ACA. Topics. Have you ever felt like you're caught in the gears of change or confused by media coverage? We find that the media rarely gets the information correct. Well, we hope to help you understand the changes in 2014 to group health plans as a result of the ACA's continued implementation. Since 2010, some changes have already been implemented. The following bullets are what we consider to be the remainders as we understand them today. Most employers will experience a transition to an ACA-compliant plan, which includes the list of changes you see on your screen. So let's begin. Actuarial value. In 2014, plans will be grouped into bronze, silver, gold, and platinum metal levels. As you can see, the size of the coin for each group is larger, ranging from bronze to platinum. This is because the plan benefits are richer and generally has a higher premium as the metal becomes more precious. This means the covered member is sharing in less of the risk. For example, a gold plan will generally have a lower deductible than a bronze plan. A bronze plan is expected to have an actuarial value of 60%, and bronze plans must test in a range of approximately 58 to 62% actuarial value to be a qualified health plan. As you see on your screen, each metal group has a different actuarial value. In order to comply with actuarial value, health plans have become more standardized, resulting in less flexibility to customize benefits. We may see this change as insurance companies approve more plan designs through the North Carolina Department of Insurance and U.S. Health and Human Services Department. Maximum out-of-pocket. Maximum out-of-pocket is not a new term. However, the ACA has reduced the limits for compliant plans, as you see on your screen. Some plans used to use the term coinsurance maximum. For these plans, the coinsurance maximum was added to the deductible to arrive at the maximum out-of-pocket. This means that for some plans, the total out-of-pocket was $15,000 for individuals and $30,000 for families when added to the deductible. The ACA requires copays for office visits, prescription drugs, and coinsurance payments to be counted or included towards the maximum out-of-pocket. Overall, this increases the richness of the plan because it reduces the out-of-pocket risk to members. In 2014, dollar limits will be eliminated at renewal. Plans can still apply a limit on the number of service visits for a specific service. For example, some limit the number of mental health visits. Modified community rating. Modified community rating is a fancy way of saying the ACA has changed how health insurers can assess their risk. The rating factors are age, tobacco use, and location. Age bands have been narrowed to 1 year from 5 years, and each cannot be more than a 3% difference. Children premiums are capped at 3 per family, meaning a family member with 5 children will pay premium on only the first 3. Premiums are level for 18 years and younger, meaning the same premium is charged for a 5-year-old as a 15-year-old. The second rating factor, tobacco, means the premium can be increased by a factor of 1.5 times for tobacco use. North Carolina, however, introduced legislation to cap this at 1.2 times. Premiums will differ by geographic location. There are approximately 15 different geographies in North Carolina. Your geographic location is determined by the head office of your business. Finally, insurers cannot rate for health or pre-existing conditions. As a result, a new enrollee cannot be denied coverage due to a pre-existing condition. The changes above apply at renewal in 2014. Until this time, legacy compliance applies to plans. Additional costs in the premium. The insurer fee of 2.5%. This is a fee charged to insurers and based on the net written premium of each insurer. The associated cost of the fee is higher than the actual charge because the fee is not tax deductible, but the premium collected to cover the fee is, therefore requiring a greater percentage to have sufficient funds to pay the fee. The fee is a flat amount across the nation, approximately $8 billion in 2014, and is divided by the market share determined by the net premium. Therefore, the fee will differ by insurer. These fees are being passed along to the small group market, self-insured market, and large group market. The reinsurance fee of $4.81 per member per month. Insurers are required to reinsure the risk to potentially unhealthy members entering the plans. This is largely due to the elimination of pre-existing conditions. A comparative effectiveness research fee of $2 per member per year. This fee is to cover the cost of researching the effectiveness of medical treatment and prescription drugs with the goal of improving quality. Wrapping up, we have seen changes to the ACA in 2013 in both the individual and small group market. We believe it's reasonable to expect future changes in 2014 as well. However, this is what we understand today as it relates to the small group, and hope it will help you plan for your health line item budget. No doubt you will have more questions. The way we keep you informed is through our HR 360 monthly newsletters and alerts. Please keep a watch for them in your email box. They contain updates, alerts, and procedures. We also offer workshops. Visit www.abioins.com and click on the Events tab to see our schedule. And if you still have questions, call Brian. Have a great day, and thank you for watching.